The procedure itself is very easy. We bring patients in once they're cleaned out and sedate them with local anesthesia, meaning not general anesthesia, light sedation. Monitor them very closely, take a flexible tube with a light on it, thread it up the rectum and look around. And this tube has a hollow working channel down the middle where we have instruments we can use to remove polyps or to take pieces of tissue if we think there's a cancer there. The preparation, however, most people have heard horror stories over the years, but it's very simple now. What used to be a gallon of liquid to drink is no longer a gallon. There are small volumes. The basic thing is you have to be on liquids for a day, and usually the preparations can be tailored so that you prep the night before, being on liquids at work or wherever you are in school that day, and then the main preparation or the pooping part is at night, and then the next day you go in for the procedure. Prep is critically important. The reason is the viewpoint we're looking out of is smaller than the inside of this ballpoint pen refill. However, if we were looking through the scope, you could see the whole room beautifully framed. So it's very important that the patient get very cleaned out so that we can do an adequate exam and not miss anything. The procedure lasts about 3 hours door to door or less. About an hour to get the patient ready, usually less than an hour to do, less than an hour to recover. You have to have someone drive you home that day because you can't take care of anyone until the next day, and then the next day you're fine. So removing a polyp is just part of the procedure. It doesn't add any time to recovery at all. And then it usually takes a couple of days to get the pathology back, in other words, what the polyp looks like under the microscope, to help us determine what we need to do next or how often we need to repeat the procedure. We can prevent colon cancer or maybe catch it early enough if we get on a good schedule of doing colonoscopies. It's not that big a deal to prep, but the bigger deal is if we help you out and catch something early, you get the rest of your life. It's real simple.